The 5 most common causes of pain in pregnancy.
Pregnancy is an incredible journey in itself. It's miraculous how the body changes in order to accommodate baby as it grows in the uterus. And it's important, though, to understand the causes of pain because that is one of the most common reasons that patients come and see me.
By the 3rd trimester, most women do, like 95% of women do start to experience back pain. It's just this change in center of gravity. It's the belly is growing, the uterus is growing along with baby. It's pulling, and it's really causing more of that lordosis in the spine. So it's pretty common to have pressure there along with having SI joint pain leading to low back pain or just tension into the lumbar paraspinal muscles. So that is one of the most common causes. But when it is a concern is when you are noticing that you're having changes in bowel and bladder. So like constipation or diarrhea, or all of a sudden you feel like you have to strain to poop or pee, something like that. Or if you're having excruciating shooting pain down the leg where you can't walk, or it's waking you up at night. Those are kind of the red flag symptoms where, yeah, you should probably reach out to a doctor and get it looked at because it can be more serious.
This is a female pelvis. So you have the lumbar spine and vertebra in the back, and then you have the sacrum right over here. These are where the pelvic bones come in contact with the sacrum is the SI joint, sacroiliac joint. And a lot of times in women, this is what gets compressed and stuck, especially from pregnancy into postpartum period. And the sacrum is also crucial in terms of making sure that's mobile during pregnancy so that we can facilitate an easier and less painful delivery process and help with recovery postpartum. So what are some things that you can do? Practicing good posture. I always go through posture, especially as the belly grows. Our posture is going to change a little bit. We have to accommodate based on this change of center of gravity. So really being mindful of putting our shoulders back, rolling our shoulders and kind of letting it fall, making sure we're not encouraging that lumbar lordosis, right? Like having that posterior pelvic tilt backwards so that we're kind of counteracting that lordosis. Heat if it helps, ice if it helps, and also seeing an osteopathic physician so that they can treat that area is super helpful. So pubic pain is pretty common in pregnancy. So this is the pubic bone. It's where the two halves of the pelvis, they come together and there's cartilage here. So this is the pubic symphysis.
And a lot of times with the relaxin, the hormones shooting way up, we're feeling loosey-goosey, joints are a little bit looser. So the pubic bone can actually shift a little bit up, down, rotate, or can even kind of go like this or this. Now this is like a very, very like dramatic way of showing you just so you know what it looks like and what's actually happening.
Another cause of pain during pregnancy is sciatica. Now, sciatica is one of my favorite topics to talk about because sciatic nerve is not really one nerve. It's actually two nerves that come down from the glutes down into the lower leg and then branches out. So it's actually a tibial nerve and then the common peroneal nerve. So when we say sciatic nerve, it's not really like one solid nerve. So I always like to educate patients on that because it's kind of interesting. But we know it as sciatica. So basically it's just pain that goes from maybe low back into the glutes and then extends all the way down to the leg. This can happen because a uterus is pressing on a bunch of nerves and a nerve bundle, the lumbosacral plexus, that's in that groin area. So you can notice some numbness, tingling here and there, but if it persists and it is a sharp shooting pain down the leg, or you're noticing weakness or bowel and bladder changes, that's absolutely when you should see a doctor, especially a pain management specialist, a PM&R doctor. It's important to do some gentle stretches, get some rest with that leg, and warm compresses can help, but really seeing a pain management specialist to make sure that's not anything more crucial, more critical to be looked at, and seeing a DO who practices osteopathy so that we can get into the actual structures, treat those structures so that we relax the muscle spasms if that's what's causing it, relaxing the restrictions that the uterus is placing into that particular region to help ease that pain so that you can stay functional. One thing you might notice is round ligament pain. Now, the round ligaments are supportive ligaments that attach on either side of the uterus, and they're meant to stretch to accommodate the growth of the uterus. But around the end of second trimester, beginning of third trimester especially, you might feel some like sharp stabbing, kind of like lightning pain in the lower belly groin area, and this can oftentimes be round ligament pain. And it can be self-limiting. It could just be like a sudden like zap and then you're good. Usually when you're going from a transitional sitting to standing, going to reach for something, bending over to get something, where you're going about your day and you just feel this when you're going to do something. And it's usually self-limiting though, so it resolves on its own, but you can use some warm compresses. You can do some gentle stretching into the lower belly area, like lifting the belly a little bit and just stretching that way. But if it persists, definitely reach out to a DO who practices osteopathy because they can evaluate the belly itself, the uterus. They can treat the uterus viscerally, the connective tissue surrounding the uterus, as well as the uterus organ itself, along with baby, and making sure that the sacrum and pelvis and everything's moving well. So if you do feel like it's something that's getting worse or it's just persistent and it's annoying and you want to be able to stay functional and active, it's really important to seek out help and to get that resolved. And a lot of times it can just take like 1 or 2 treatments and it should be able to resolve on its own. And so pelvic pain itself can feel like a kind of like a heaviness, just like going deep into the pelvic floor region. And it's important to, if it's getting too much and so much that it's kind of interfering with bowel movements, or you feel that heaviness even when you're having a bowel movement, it's important to get it looked at because it could be an organ prolapse. So if you are noticing a significant amount of pelvic pain, like heaviness into the pelvic floor or just pain in general deep in the pelvic floor, it's important to see a pelvic floor physical therapist or a DO, an osteopathic physician who specializes in pregnancy, in treating the sacrum and pelvis and pelvic floor in general. So I will do internal pelvic floor work as well as external pelvic floor work depending on when in the pregnancy a patient is, because we don't want to go intravaginal if we don't have to, but sometimes it can be helpful. And that's why I like to address a lot of pelvic floor issues prior to pregnancy, because if you are already having like stress incontinence and things like that, or pain in general, it's important to get it looked at because it's only going to get worse during pregnancy. So we want to address that beforehand and resolve it, or at least ease that so that it doesn't become considerably worse later on during pregnancy.